Good, how are you?
Good, thank you.
Now tell me your name.
My name is Navid. I'm a student, senior in college, and I play golf.
Play golf. Okay, very cool. I'm Sarah. I'll be your counselor for this season, however many sessions you want to do. So I guess we can just start explaining the problem. And first, before we begin, actually, I want to emphasize anything that you say is confidential. Apart from, there are a few things, if you mention ways that you are wanting to like harm yourself or harm others, there are some reasons that we have to legally report that to others, but for the most part, everything that you say will be kept confidential. So you're able to share freely.
Okay, sounds great.
Mm-hmm.
Well, I've played sports all my life, and before coming to the United States with a scholarship to be a student athlete, I never had problems with injuries.
Mm-hmm.
And as soon as I got here, I started getting injured, and even though they were small injuries, I started to think that maybe I'm doing something wrong or something different, and that's just making me get injured all the time.
Mm-hmm.
But it wasn't until last year that when I transferred to William Carey that I started having a lot of pain. When I went to the doctor, the orthopedic, they told me I have nerve damage, and at first they said I just need a small surgery and I'll be okay in a couple months. But after taking the surgery and going through rehab, it didn't get better. So I went to the orthopedic again, and they told me I need another surgery. So that led me into 10, 11 months off. And I had to change my way of living because as a student athlete, you have a very big routine that you go practice, all that. And I had to change that and try to be a normal student, which was kind of weird for me and different, and I didn't like it because it's just not getting better, and I feel like I'm getting to a point where I think it's just never gonna get better.
Mm-hmm.
So that's why I came here to see if there's anything that can help me change my perspective on the problem.
Yeah. So one thing that typically is helpful, and as I've been working with clients, is to show or to kind of identify the thought patterns that you have in your head, because sometimes everybody has thoughts, right? And we have very negative and it can be destructive thought patterns that go in our minds that can just cause us these emotions. So when you have a big emotional response, that is a sign that maybe there's a negative thought pattern going on behind it. So let's do that here. Let's go ahead and, from your situation, would you say it's safe to say one of the automatic thoughts that is constantly, the thought that's always in your head is, it's never going to get better, and you'll never get to do what you love and never get to play? Would you say that's a fair assessment?
Well, that thought, especially in the last 12 months, has been growing because even though I'm someone that doesn't like to give up and keeps trying to get better, but after all this time, when you see that there is barely any progress, and I want to keep thinking that yes, it's gonna get better, but in the back of my head, there's this thought as I'm someone that overthinks a lot of stuff. There's this thought that, oh, it might never actually get better, and that thought has been getting bigger with time. So I would say so.
Yeah. So that's the thought pattern that's been going on. And then the next step, once you've figured out, it's a great step that you've identified that as what's been going on in your head rather than letting it take over you. The next step is to assess, is this true? Like, is this a true thought? Is it accurate about yourself? Or is there some falsehood to it? So next, let's do that. Would you say that is based on all of the information that you know as of now? Do you think that's a true assessment, that that you'll never get better, that you'll never have this enjoyment? Or is there some kind of catastrophizing or imagining the worst in that you're doing?
I mean, to be honest with you, from a medical approach, I should get better. Which I should have been getting better, and I should get better with time, because at the end of the day, it's something that doesn't get better in a couple of days. But I keep working and trying to like feel better about it, I guess. I haven't seen improvement in a year, when I've been told it was just gonna be 2 small surgery, and I should have been okay like a long time ago. So the doctor says obviously I'm gonna get better, but the results or the outcome of the surgeries are not looking the same. Yes.
That's very difficult. It's hard to, something that you love, when you're not able to do it. Yeah, that is a very difficult situation. So you've kind of analyzed that there could be truth to it, there could be healing, you could heal and be able to. So you're at this middle point of, you're not sure whether it's accurate or not accurate. So we'll kind of go 2 different ways. The first, if it is accurate, and maybe in the worst that could happen in this scenario, you don't get to go back, are there, what are other ways that you can find joy still, and still, even in, whether you do get to go back and right now you're just waiting, are there other ways that you could maybe work towards still having contentment and having joy in this waiting time?
If the outcome is that I'm never gonna get better, I'm never gonna be able to play, yes, I mean, at the end, I can be a coach, I can still be involved with the sport, being a coach, or sports psychologist, or anything related to helping the players, and with my experience and all that, it's gonna be hard to accept, especially the first few years, because you're gonna see people playing and you want to do it but you can't. But yes, I think at the end I will be able to find joy in trying to help others to get where I wanted to be. And well, if I do get better and I recover my confidence, that'll be great.
Yeah.
Just because I started to play this sport because I loved it and I had fun with it, so if I can do it again, it would be amazing.
So, just so we can kind of follow through with the steps in this process of analyzing our thoughts, what is your, just so you can be aware of it as your week goes on, what is your emotional response, or maybe your behavioral response, things that you act, things that you do or think or feel when you think this, when your thought is, it's never going to get better? What is some of your emotions that come along with that?
I mean, there's always a lot of, I feel more sad than anything, because as I said, it's something that I grew up with and I love the sport, so it was the thing that gave me the most joy growing up. So I feel sad and frustrating, because it just doesn't look to get better, and I can't prove to myself or to my coach or anyone that I'm getting better and I still can play good. But yeah, and it kind of affects me during the entire day on anything.
Yeah. So I will challenge you when you feel those emotional responses, the overwhelming sadness or frustration, and you can tell it's affecting your whole day, as you've explained. This can be a sign, now that we've discussed it, a sign that, oh, I'm experiencing this automatic thought pattern of, imagining the worst and thinking that it's never going to get better. And you can come back and first remind yourself of the truth, remind yourself of factually, you said that the doctors have explained it should get better in time. And even, as you said before, even if it doesn't, the 2 ways, even if it doesn't, you can still find joy and contentment in being a coach. All of these things are not hard, or not easy to accept, but I would challenge you, as you feel those emotions about this topic, that you just remind yourself of that truth, to make sure that you're not gonna spiral into thinking the worst and into that kind of pit area.
Yes, I'll for sure try to do that, because at the end of the day, the sport is not my entire life, and I don't want to everything else to be affected because of my mood that comes from the injury or not being able to play the sport. So yes, I'll try to approach situation like that, and hopefully we'll get better for our next session.
Yes. Another little piece of homework, I'll call it, but just something that I think would benefit you would be to, whenever you do feel those emotional responses, negative emotional responses, to try to analyze your thought patterns at that moment, because there might be other thoughts that are affecting you that you don't realize. For example, you're aware right now about the way you're feeling about the sports and this situation, but if there's maybe other factors, other friendship factors, or family struggles, or different health issues, like there could be other factors at play to how your overall well-being is. So this week, or before our next session, you can write down the emotional response you're having, and then the thought, if it's a repeated thought, and how that is affecting you. So whether that, and then analyze, is this thought true? Is it accurate? And try to replace it with something that is true. So that is one helpful way of approaching different negative emotions that we have.
Okay, sounds good. I mean, definitely, I think maybe the way my family sees or tries to help me with it is not the best, but I didn't really think that it could be one of the things that overwhelms me. But yes, I'll think more deeply into it, and I'll write them down and bring it to the next session.
That sounds good. Thank you for sharing. Thank you for explaining the issue that's going on, and we'll keep working on it to try to work towards progress and to make sure all of our thoughts are accurate about ourselves and about the situation. So,
sounds good. Thank you for having me.
yes. Have a great rest of your day.
You too.